Welcome to Akweya TV, the station that talks about history, art, culture, and how they relate to development. And this is the report we're bringing to you at this hour. My name is Idajo Aja. The Executive Director, National Primary Health Care Development Agency, Dr. Faisal Shuaib, has commended a collaboration between the National Primary Health Care Development Agency and the Association of Community Pharmacists of Nigeria, ACPN, in the administration of the COVID-19 vaccines across the Federal Capital Territory and other states in Nigeria. Dr. Shuaib, speaking at the flag-up of the COVID-19 vaccination in accredited community pharmacies, said community pharmacies are some of the most easily accessed health facilities in the nation. With over 6,000 community pharmacies spread across the country, the distribution of the vaccines to citizens of the nation will be faster and more effective.
Distinguished ladies and gentlemen, it gives me great pleasure to be part of this epoch-making flag-off of the COVID-19 vaccination at community pharmacies. And it is important that we're having this event not in our offices, but in front of a typical community pharmacy. So I thank you very much for your leadership. I want to recognize the strong leadership and commitment of the Pharmaceutical Society of Nigeria and the Association of the Community Pharmacists of Nigeria for their relentless effort to ensure that this collaboration becomes a reality. Indeed, this collaboration is a step in the right direction, as it is in furtherance of our determination to expand access to COVID-19 vaccination and other immunizations services across the country.
The Executive Director disclosed that about 30 million Nigerians have received their first dose of the COVID-19 vaccine and charged all citizens to go to the nearest health facilities, including community pharmacies, to take their jab. He added that there is enough supply of the COVID-19 vaccine in the country.
That this is an unprecedented and novel initiative that we have embarked on in a country to strengthen our health security architecture. As you are aware, Nigeria, through the National Primary Healthcare Development Agency, the Federal Ministry of Health, and the Presidential Steering Committee, launched the Skills 2.0 as one of the national strategies for COVID-19 vaccination rollout. In the spirit of inclusiveness and in our appreciation of the fact that effective control of the COVID-19 transmission through vaccination requires all actors in the health landscape to be involved, the Skills strategy entails the expansion of vaccination sites beyond the government health facilities to include private health facilities and community pharmacies in line with the global best practices.
In an interview with the press at the end of the event, Dr. Shuaib emphasized that the concern is not just the dissemination and administration of COVID-19 vaccine, but every other vaccine needed to save lives and prevent other forms of diseases. In the same spirit, the Executive Director, FCT Primary Health Care Board, Dr. Yakubu Mohammed, said it is a big opportunity for them to work with the pharmacists to make COVID-19 vaccines available in the 2,800 communities around Abuja.
I see this as a big window of opportunity. Working with the community pharmacies, we at the FCT Primary Health Care Board, we want to ensure that we work together to create synergy and convergence to make sure that we reach out to the entire people residing in the FCT.
He also charged the pharmacists to go beyond being service providers to community mobilizers by propagating the right perception about the vaccine in the communities.
We work closely with you through planning to identify your needs where you think you will work with us to reach out to those people, that those eligible clients, both people above 18 and our students that are intended to travel out from those between the ages of 16 years and above who require this COVID-19 vaccination, so that we collectively work together to expand access, make sure that people access the doses, people come back to receive their follow-up doses and booster doses, so that together we work towards achieving the targets that we set out to achieve, not only in MCT but across the country in general.
The country representative of the United Nations Children's Fund, UNICEF, Mr. Peter Hawkins, who was represented by Pharmacist Pascal, said the UNICEF is committed to supporting initiatives geared towards making the COVID-19 vaccine available to all, and commended Nigeria for taking this giant step.
I'm very much impressed with the way our ED is leading this process. Is always in the front seat to make sure the vaccines reach the community. And me being a pharmacist, I'm even more impressed with the initiative that the pharmacists have taken to take COVID vaccination as one of their own. And on behalf of my country representative, Peter Hawkins, UNICEF is committed to continue support NPHCDA to make sure these vaccines are always available and are stored in a contained manner. We're expanding the storage facilities across the country to make sure that these vaccines reach in important stage to everyone.
Flag off of the collaboration between the National Primary Health Care Development Agency, NPHCDA, and Association of Community Pharmacies, ACPN, which held on Tuesday, 31st of May 2022, was hosted in a community pharmacy, Nolat Pharmacy Limited, and Nafara Plaza, Gwarimpa, Abuja. The National Chairman, Association of Community Pharmacists of Nigeria, Pharmacist Wale Oladigbolu, in his speech, appreciated the Director of National Primary Healthcare Development Agency for making the vaccine available. He stated that about 15% of Nigerians have taken the vaccine, but their target is to move it to 70% through this collaboration. Pharmacist Adewale Oladigbolu, in an exclusive interview with Akweya TV, said the vaccine is going to be free for the first 3 months.
Flag was a landmark in the annals of history of public health practice in Nigeria. Before this time, community pharmacies do a lot of things, but they are not well placed within the public health sector. So today we are flagging off the achievement of a landmark, and that is the opening up the vaccination space to community pharmacies. That means that ordinary Nigeria can walk up to an accredited community pharmacy and they have their vaccination done there. It is indeed a landmark. It brings Nigeria into the same plane with other countries of the world where vaccination takes place in community pharmacy. And we have the Executive Director of Primary Health Care Development Agency, Dr. Faisal Shuaib, to thank for this. We have his team to thank for this. These are different set of Nigerians, very passionate about people's health and always strong on the need of the people. So we have them to thank for it.
The high point of the event was the flag-off ceremony by the Executive Director, National Primary Health Care Development Agency, Dr. Faisal Shuaib. And that's the report we're bringing to you at this hour. Please do share the story and subscribe to our YouTube channel. My name is Idajo Aja.